Welcome to the Operation Smile Bilateral Cleft Lip Surgical Outcomes Evaluation. This is a standardized evaluation of four components of the bilateral cleft lip repair: the nose, the philtrum, the lateral lip, and the free vermilion. Each of these four elements is scored separately from 0 to 2. A score of 2 is considered excellent, 1 is satisfactory but with room for improvement, and 0 is unsatisfactory. The scores of all four components are added together for an overall score ranging from 0 to 8. To score the nose, we look for symmetry of the nostrils in the horizontal dimension and symmetry of the alar bases. A score of 2 is given when there is symmetry of the nostrils in the horizontal dimension and symmetry of the insertion of the alar bases. A score of 1 is given when there is asymmetry of one component, either the horizontal dimension of the nostrils or the insertion of the alar bases. A score of 0 is given if there is asymmetry of the horizontal dimensions of the nostrils and asymmetry of the alar bases. To score the philtrum, we look for symmetry of the philtral columns with a philtral width less than or equal to the width of the columella, and we look for precise apposition of the white roll. A score of 2 is given when the philtrum is symmetrical and proportional to the columella, and there is precise apposition of the white roll. A score of 1 is given when the philtrum is mildly asymmetric or mildly wide. And a score of 0 is given when there is marked difference in the philtral column height and the philtrum is wide. To score the lateral lip, we look for symmetry of the horizontal distance from the commissure to the cupid's bow peak between both sides, and we look for symmetric fullness and thickness in the vertical dimension. A score of 2 is given when there is both horizontal and vertical symmetry of the lateral lip elements. A score of 1 is given if there is horizontal or vertical asymmetry of the lateral lip elements. And a score of 0 is given when there is asymmetry of both the horizontal and vertical components of the lateral lip. To score the free vermilion, we look for a smooth and symmetric free vermilion border. A score of 2 is given when there is a symmetric and smooth vermilion margin and red line. A score of 1 is given when there is a mild distortion or asymmetry of the vermilion margin and or the red line. And a score of 0 is given when there is a major distortion in the free vermilion or red line, causing a whistle deformity. Thank you for learning about the Operation Smile Bilateral Cleft Lip Surgical Outcomes Evaluation. For more information, please see the Surgical Outcomes Program Reviewer's Guide.